I'm Dr. John Scharfenberg from Loma Linda University. I've been a professor of nutrition there for over 58 years. I'm 93 now, so you can tell by what I'm talking about that I know what I'm talking about because it's worked for me. Now, we've had some major breakthroughs in health. We had one about Louis Pasteur when he did the flask experiments. He discovered the germ theory. That was a tremendous advance in health. Then after Pasteur, we had Fleming. You remember about the penicillin? When he discovered penicillin, that was another tremendous advance. We have now another advance that's just as good, just as important as those two. This advance has to do with primordial prevention. Now, you need to understand what that word means, and I'm going to explain it to you. We now know we can reduce the risk of heart attack or stroke by 80%, just with lifestyle, without any medicines at all. And this is something that all scientists are agreed to. The European Cardiology Society agrees, the American Heart Association agrees, the World Health Organization agrees. This is amazing to see all the scientists agreeing on these points. If we avoid 7 risk factors, we can reduce our heart attack risk 80%. We can reduce our risk of getting type 2 diabetes by 88%. Now, you need to know what these risk factors are. This is without any medicine. We can do better than any medicine that they have to offer. Even the statin medicines, they say, are only good for about 30% reduction. But here, with lifestyle, we can reduce risk by 80%. Here are the factors you should know about. Number 1 is cigarette smoking. That's the major cause of death in many parts of the world today, cigarette smoking. Now, in some countries, we've lowered our cigarette smoking quite a bit. We have here in the United States, only 15% of Americans are now smoking, adults, only 15%. But many countries, developing countries, it's increasing. We need to stop smoking, number 1. Number 2, we need to get rid of the alcohol, at least cut it down. The standard recommendation on alcohol today is, if you've never ever started to drink, don't ever begin. But if you are drinking, cut down to no more than 1 drink a day for women and 2 for men. But the preference is get rid of it entirely. We would like people to stop drinking alcohol. It's a major risk factor in heart disease, increases high blood pressure, increases rectal cancer, increases breast cancer. We don't want to use that alcohol. We need to do something about that. Then the third risk factor is lack of exercise, inactivity. 1/3 of the women who have heart attacks, it's because of inactivity. We need to get exercising at least 30 minutes every day, 5 days a week, at least. Now, if you're overweight, you need to go even longer than that, at least an hour and perhaps an hour and a half every day. But for exercise, here's what you need to know. This one scientific study you need to know. If a person smokes, if he has high blood pressure, and he has high serum cholesterol, but he exercises 30 minutes a day, he has a lot lower risk of dying than the person who's inactive, who doesn't have any of those risk factors. Did you understand what I said? A person who smokes has all these bad risk factors. He has high blood pressure, he has high blood cholesterol, but he exercises. He has a lower risk of dying than the person who doesn't have any of those problems, who doesn't exercise. So inactivity is a major risk factor. We've got to get people exercising again. Now, the 4th risk factor is weight. We need to get people to get their weight down to where it ought to be. And in fact, we haven't been very successful at it. That the real goal now is to keep people who are normal weight from gaining weight. But increased weight does increase the risk of heart disease. It increases the risk of many cancers. So we got to do something about the weight problem in this country. Now, we have three big problems that have to do with life expectancy. One is cigarette smoking, the other is hypertension, and the third one is overweight. Those are the three big things we got to do something about here in the United States. Now, besides weight, now I did tell you that weight is not a problem if you exercise. A person who is obese but exercises 30 minutes at least 5 days a week has a lower risk of dying, about only half the risk of dying, of a normal weight person who's inactive. So exercise is extremely important. Now, besides smoking, alcohol, exercise, and the fourth risk factor is weight. Now the fifth one you got to know about. The fifth one is, we used to say, too much meat. That did not go over very well with the public. People like their meat. So they've tried to change that to make it more positive. And they say we need to eat more fruits and vegetables. But really, in the back of their mind, they're thinking less meat. Yes, we need more fruits and vegetables. We're not getting enough fruits and vegetables. Fruits and vegetables have a lot of potassium. That decreases the risk of hypertension, for example. So we need more fruits and vegetables. Decreases the risk of heart disease, reduces the risk of a lot of the cancers. So that's 5 risk factors. Now, they've added 2 more to these 5. They've added the one which says another risk factor is high blood pressure, okay? Another one is high blood cholesterol. But if you live properly, the first 5 factors, you take care of those, you're less apt to have high blood pressure or high serum cholesterol. But now, as far as blood pressure is concerned, 3 ways to keep it down. Exercise is the best preventive we know for keeping our blood pressure down. Exercise. Or even if you have hypertension, we've got to get people going on a good exercise program. Those first 5 risk factors we mentioned, smoking, alcohol, lack of exercise, overweight, and lack of fruits and vegetables, all of those have to do with hypertension, high blood pressure. So the first way to lower your blood pressure is take care of all those 5 problems. Now, if you have to do something else, you could look at it another way. If you're a vegetarian, vegetarians have about 40% reduction in hypertension. So that in itself is useful. Third thing to do to lower your blood pressure is to cut down on the salt. We're getting too much salt in our diet. We need more potassium than we do sodium. We should have twice as much potassium in the diet as in sodium. But we got to just turn it around. We're getting twice as much sodium as we have potassium. So we've got to do something about the blood pressure. So cut down the salt, be a vegetarian, or take care of those 5 risk factors for heart disease, and that will handle the blood pressure problem. Now, what about the blood cholesterol problem? Well, that is a problem. We're having too many people with high blood cholesterol. We need to get our blood cholesterol down. And these same risk factors we talk about that have to do with high blood pressure also have to do with blood cholesterol. Cigarette smoking, alcohol, by the way, increases the blood pressure, but alcohol also increases the risk of rectal cancer and things of that type. We need to do something about those 5 risk factors in keeping our blood cholesterol down. The overweight brings it up. Particularly the saturated fat in the diet is what does it. We need to do something about the saturated fat and the cholesterol in the diet in order to keep our blood cholesterol down. So we got these 7 risk factors to think about, and the first 5 are the main ones. Let's review. It's smoking, alcohol, inactivity, overweight, and lack of fruits and vegetables. In other words, too much meat And now recently they've added too much sugar to it because sugar increases the risk of heart disease too.
Hi, I'm Marcy Horonis with Balmar Health. To see more videos with Dr. Schaffenberg in it, you guys should subscribe to my YouTube channel. We talk about a ton of fun stuff like healthy vegan recipes, product reviews, health and beauty tips, and so much more, and I want all of you to be a part of it. Let me know in the comment section if there's anything else you guys would like to see. Thank you so much for watching today, and we will see you next time.